Okay, let's see what's going on here. So this is live. Hello, everyone. Have a good day, everyone. So I'm not quite sure what's going on here. And so let me know if you can see me with the live stream. Okay, good. Yeah, there's some issue with the thumbnail and everything. So I hope that you can stick around throughout the entire um, lecture today or the Q&A. And so let's get started with our continuation on the gastrointestinal concepts. We'll tackle about the IBS and also the IBD. So here are the following questions that we're going to talk about today. So question number one here, a client with a 4-year history of ulcerative colitis is hospitalized due to an exacerbation of symptoms. Which of the following factors is most likely to be a significant contributor to the flare-up of the disease? Is it A, demanding and stressful job, B, switching to a modified vegetarian diet, or C, starting a weightlifting regimen, D, walking 2 miles each day? So this is a client with ulcerative colitis hospitalized to an exacerbation of symptoms. Now, the correct answer for this item is letter A, a demanding and stressful job. We know that stress and emotional strain can strongly be associated with ulcerative colitis and also the exacerbation of that disorder, even though it is not really a direct cause of the disease. Okay, so it is a contributing factor. If you'd answered letter A, letter B rather, switching to a modified vegetarian diet, this is basically not a known thing to trigger the flare-ups. And if you answered letter C, starting a weightlifting regimen, we know that exercise programs like weightlifting are not recognized as a cause of the exacerbation as well. And the same thing with letter D. It's not going to provoke or worsen the symptoms. Okay, wonderful. Welcome, everyone. We got AJ Ike, Anita, Stella, and we got Ola. Welcome, everyone. Let's proceed to our next question today. And this is on a 43-year-old male patient has been newly diagnosed with Crohn's disease after experiencing frequent diarrhea and losing 10 pounds over 2 months. What should the nurse include in the teaching plan? We got our choices: medication regimen for A, B, limiting fluid intake, C, enteral feeding, and D, restricting activity levels. New diagnosis of Crohn's disease, and now is experiencing frequent diarrhea and lost about 10 pounds over 2 months. So what would be the teaching that you're going to be doing for this patient? Is it A, B, C, or D? The correct answer for this question is letter A, medication management. We know that with the pharmacological therapy in this patient, we need to make sure that they are able to maintain remission, especially for this IBD. And this can be somewhat applicable to the Crohn's as well, both Crohn's and ulcerative colitis. If you answered letter B, which is the limiting fluid intake, the fluid intake around this time should be increased, not restricted, in order to prevent dehydration. If you answered letter C, enteral feeding, this kind of nutrition is not commonly needed unless the patient cannot really consume food by mouth. And if you answered letter D, it's restricting activity levels. This is only necessary for those patients experiencing severe fatigue, but it's not mentioned in this case. Let's move on into the next question. A client is placed on long-term sulfasalazine therapy for ulcerative colitis. What dietary advice should the nurse provide to help the client avoid potential nutrient deficiencies? A, increase citrus fruits. B, eat more green leafy vegetables. C, add eggs to the diet. And D, increase consumption of dairy products. This is about a dietary advice um, for this client with a possible nutrient deficiencies. And we are talking about a patient that is taking sulfalazine for long term in ulcerative colitis. The correct answer for this test question would be 2. Help the client avoid potential nutrient deficiencies. So what would be your best answer here? It will be letter B, which is eat more green leafy vegetables. We know that the medication, the sulfasalazine, this is actually an anti-inflammatory, right? It can lead to deficiencies in folic acid. And our option of letter B, which is green leafy vegetables, are actually rich in that vitamin. Okay, if you had answered letter A, increase citrus fruits. If you answered eggs to the diet, increase consumption of dairy products. These do not provide significant amounts of folic acid. So think about sulfalazine. This patient should have much more of a supplement, especially folic acid rich containing items. Let's have number 4. A patient with Crohn's disease develops a fever and presents with urinary symptoms and fecal smelling urine. What should the nurse include in teaching to individualize care of this patient? A, bacteria from the perianal area can enter the urethra. B, fistulas can develop between the bowel and bladder. C, ensure adequate fluid intake. And D, empty the bladder before and after intercourse. This is a worrisome complication about this type of disorder. There is now fecal smelling urine. Now, the correct answer this time is letter B. That's the fistulas can develop between bowel and the bladder. And this can allow the fecal matter to enter the urinary tract and cause the infection. Now, if you answered if you had selected either A, C, or D, these are general preventive measures for the urinary tract infection, but do not really address the specific issues of the fistula formation in Crohn's disease. So here in letter B, you're actually pointing out the reason why this patient is experiencing such fecal smelling urine. And then another education can happen after that has been started. Let's have number 5. A nurse is planning care for a client with ulcerative colitis experiencing a symptom flare-up. Which tasks can be delegated to an unlicensed assistant? Select all that apply. We have letter A, assess bowel sounds. B, provide skincare and after bowel movements. C, monitor the response to antidiarrheal medications. D, record intake and output. E, obtain the client's weight. So this is a delegation question. Now, think about those actions that are in their scope of practice. Now, the correct answers for this question, this is all select all that apply. These are the choices. We got letter B, D, and E. So that's to provide skincare after bowel movements. We also have record intake and output. And E, obtain the client's weight. Now, if you answered letter A and C, these are going to require an RN. This is all about assessment and evaluation of the patient's responses to the medication. And this is something that you cannot delegate to an unlicensed personnel. It's not in their scope. All right, let's move on to number 6. A patient has recently undergone a proctocolectomy with ileostomy for ulcerative colitis. What should the nurse include in the discharge instructions? A, limit fluid intake to avoid excessive drainage from the stoma. B, be cautious when consuming high fiber foods to avoid ileum blockage. C, irrigate the ileostomy daily to avoid needing a drainage pouch. Or D, change the ileostomy bag daily to prevent leaks. We are talking about a patient who just had a proctocolectomy and now has an ileostomy in place for the ulcerative colitis. So which option would be that appropriate action or a teaching for this patient about discharge? The correct answer in this question, it is letter B. Be cautious when consuming high fiber foods to avoid ileum blockage. We are going to instruct the patient around this time and also teach them that high fiber foods should be introduced gradually, and these food items should be chewed thoroughly in order to prevent the obstruction of the ileostomy. Now, if you answered letter A, limit fluid intake, we know that fluid should not be restricted because patients with ileostomy require more fluids, and this is to compensate for the loss of the colon water that's being absorbed. And if you answered letter C, irrigate the ileostomy daily to avoid needing a drainage pouch, this is not going to be necessary for ileostomy because we know that the output is going to be continuous. And if you answered letter D, change the ileostomy bag daily to prevent. We know that the emptying of the bag will be frequent, but changing ileostomy appliance and also including the bag will happen every 5 to 7 days. Okay, so it's not going to be a daily thing for you to change the appliance and also the bag. Let's move on to number 7. When prioritizing care for a client hospitalized with an exacerbation of ulcerative colitis, which goal is most important in the initial days of treatment? Is it A, encourage independence and self-care, B, control diarrhea, C, ensure proper nutrition, D, provide comfort, and promote rest? We are being asked here about the goal during the initial days of a treatment for this patient with exacerbation of ulcerative colitis. The answer for this question is letter B. That's control diarrhea. When the patient has an exacerbation of this condition, they are going to have loose stools, and this is priority during this time, and we really need to avoid or prevent the fluid and electrolyte imbalance around this time. This can really happen fast. Now, if you answered letter A, letters A, C, and D, encouraging independence and self-care, or ensuring proper nutrition, or D, provide comfort and promote rest, these are also important goals, but this can be secondary as well to managing the acute symptoms of the diarrhea. So we need to prioritize letter B. Now let's have number 8. A 65-year-old client with dehydration from an ulcerative colitis flare-up is receiving IV fluids at 125 mL per hour. Which findings should the nurse prioritize reporting to the healthcare provider? Is it A, no urine output in 4 hours, B, dry skin with poor turgor, C, crackles halfway up the chest, or D, 5 loose stools in 6 hours? Now, your patient has dehydration from that ulcerative colitis flare-up. Now, look into the treatment that is being delivered. It's an IV fluid at 125 mL an hour. So, now we are going to prioritize and to find that selection, of course, that should be reported to the medical provider. This is going to be an ASAP thing. So, what do you think would be that complication that can arise from this intravenous fluid administration at 125 mL per hour? The correct answer, it is letter C. Okay, the crackles halfway up the chest, it simply indicates overload, and this is very concerning, especially in a patient that is older, 65 years old. So this is something that you should think about, especially when you're treating dehydration or hypovolemia in this age group. You got to make sure you have your baseline assessments before you administer the IV fluid. Make sure that you have thoroughly auscultated their lungs, and make sure you're going to um, follow up, make evaluation. Make sure that from time to time you're going to ask them if they're feeling okay as far as their breathing. They can develop the overload really fast. Now, if you answered letter A, B, letter D, these are findings that are expected. Since we are talking about a patient that has a dehydration, these are also going to require monitoring and follow-up, but these are not as urgent compared to the fluid overload that this patient is experiencing. Crackles halfway up the chest, again, we are going to deal with a breathing issue. This is something that you should think about. Now, moving on to the next question, number 9. The nurse assesses a client with ulcerative colitis who has experienced diarrhea for a week. Which complication is most concerning? Is it A, heart failure, B, deep vein thrombosis, C, hypokalemia, or D, hypocalcemia? Your answer, please, for number 9. So this patient had diarrhea for over a week. So which complication is most concerning? Is it heart failure, DVT, hypokalemia, hypocalcemia? Very good for identifying letter C, Stella. That is a correct answer. Letter C, that is hypokalemia. With a patient having a persistent diarrhea for a week, we are going to be too worried about potassium loss. Probably around this time, your patient's potassium could be around 2.5 or less than 3. This is a potentially dangerous complication. We know about the results of hypokalemia. We'll encounter some dysrhythmias around this time with this severe form of diarrhea. Now, if you answered letter A, letter B, letter D, these are also conditions that can be concerning, but these are not associated directly with the diarrhea that this patient is experiencing, right? Think about the heart failure here. This is mostly going to be aggravated or going to be a complication, especially if there's going to be fluid overload. But with this case that your patient is actually losing a lot of fluids, that is kind of like you're not going to be able to associate with that complication. Now, for hypocalcemia, there's going to be some calcium loss as well, but it's not as going to be as life-threatening compared to the hypokalemia. It's mostly the potassium that will be lost in a case of this week-long diarrhea. Let's move on to number 10. A client hospitalized with acute ulcerative colitis exacerbation reports severe abdominal cramps and passing 15 bloody stools daily. What is the nurse's initial intervention? We're talking about 15 bloody stools daily with severe abdominal cramps, and this is a case about ulcerative colitis exacerbation. Now, you're being asked here about your initial action. Is it A, administer IV metoclopramide? Is it B, make the patient NPO? Or are you going to administer vitamin B12 injections? Or D, teach about possible colectomy surgery? Now, I really want you to focus about what these actions gonna do. Okay, is this action going to treat the immediate issue of the patient, or is this action going to be intended for a much longer type of plan or a goal? So the correct answer in this question, it is letter B, make the client NPO. When your patient is having that ulcerative colitis exacerbation, if they're having severe cramping, and if they're doing this 15 bloody stools per day, Your goal here is to make sure you're resting their bowel, okay? You got to keep them NPO in order to decrease the peristaltic activity in the bowel. This NPO can also reduce the inflammatory processes. It can also reduce the cramping and also reduce the further irritation of the intestinal lining. Now, if you answered letter A, metoclopramide, I want you to recall what this classification or the classification of this drug. We know that metoclopramide, or this is popularly known in its brand Reglan, this is a medication that can increase the peristalsis. So with this medication, you're going to expect more bowel movements, and this medication can worsen the patient's symptoms. If you answered letter C, administer vitamin B12 injections, this is unnecessary in ulcerative colitis because the ileum is not affected. Okay. If you answered letter D, teach about possible colectomy surgery. Although colectomy is going to be required in severe cases, but our initial focus during the immediate phase is to manage the symptoms conservatively. Okay. Now let's go back real quick into letter C, administer vitamin B12 injections. So again, this is only required when the ileum is affected, but this is most commonly seen in Crohn's disease, not acute ulcerative colitis. All right. So make sure that you recall the differences between the two. Let's have number 11. A client newly diagnosed with ulcerative colitis who has just been prescribed steroids asks the nurse why they are being given. The nurse should explain. A, steroids will cure your ulcerative colitis, or B, steroids are prescribed during severe flare-ups to help reduce the bleeding, or C, using steroids long-term can extend remission periods, or D, steroids have more harmful side effects than benefits for ulcerative colitis. Alrighty, correct answer for this test item, it is letter B. That is, steroids are prescribed during flare-ups or severe flare-ups to help reduce the bleeding. Okay, the medication, especially the corticosteroids, are going to be used because this can help the inflammation and it can also decrease the risk of bleeding. We know that it cannot cure the disease itself, but it has that significant role in order to manage the symptoms during the severe episodes. If you answered or if you selected letter A, we know that ulcerative colitis is a chronic disease and steroids really cannot cure. Okay. If you answered or selected letter B, steroids, or letter C rather, using steroids long-term can extend remission periods. Well, we know that steroids is not recommended for long-term use because it's not going to prolong remission periods. It can actually lead to significant side effects, right? So this is not going to be used for long-term. Okay, remember that. If you answered letter D, steroids have more harmful side effects than benefits for ulcerative colitis. They do have side effects, but the benefits of short-term use during the flare-ups typically outweigh the risks. Let's have number 12. How are you doing this time? Number 12, which nursing intervention should be included in the care plan for a 42-year-old male patient admitted with an inflammatory bowel disease flare-up? Is it A, limit fluid intake, B, check stools for blood, or C, encourage walking 6 times daily, or D, increase fiber in the diet? You have a 42-year-old male admitted with IBD flare-up. Again, you can easily spot those distractors, such as your letter A, limit fluid intake. You know that you're not going to restrict, right? Because of the dehydration. This is a common risk. during an exacerbation. If you answered letter C, encourage walking 6 times daily, this is probably not feasible for this patient, especially that they're going to end up with severe fatigue during exacerbations. Your patient is going to lose a lot of fluids and also electrolytes this time. Think about the hypokalemia, the muscle weakness. So 6 times daily ambulation would be a lot for this patient. If you answered letter D, increase fiber in the diet, during the exacerbation, when you're going to increase their dietary fiber, this can actually worsen the GI symptoms. It can increase the GI motility, and also it can lead to the diarrhea. So you're actually causing worsening. What you're going to do instead would be to select letter B, which is check stools for blood. Okay, this is very important because the bleeding usually can happen, and we know that anemia can follow after that. And we really need to detect this kind of complication to prevent severe complications, especially with a hemorrhage. Okay, let's have number 13. A client with ulcerative colitis is prescribed sulfasalazine. What instructions should the nurse provide about taking this medication at home? Select all that apply. Is it A, drink enough fluids to ensure a urine output of 1,200 mLs to 1,500 mLs per day? Or B, stop taking the medication and notify the healthcare provider if signs of intolerance occur? Or C, discontinue the drug if your urine turns orange, yellow? Or D, avoid activities that require alertness? And E, skip a missed dose and continue with the next one. Your patient is taking sulfasalazine for a ulcerative colitis. You're actually going to give them some instructions about this medication. So which of these instructions are appropriate? You have to select all that apply. If you answered letter A, drink enough fluids to ensure a urine output of 1,200 mLs to 1,500 mLs per day, this is very important because we know that sulfasalazine, anything that is sulfa containing medication, they are going to cause formation of renal stones. So what you're going to do here is to encourage your patient to increase their fluid intake to prevent the stone formation. Okay? If you answered letter B, stop taking the medication and notify the healthcare provider if signs of intolerance occur. So these possible intolerances are probably your abdominal pain, bloody diarrhea, fever. This would really require the patient to stop taking the medication and make sure that they notify the medical provider right away. They don't have to wait for a day. Make sure that they report this to the medical provider to make sure that this provider can follow up, make some evaluation, a possible diagnostic test. Okay, let's have letter C. Is that going to be a correct answer? Discontinue the drug if your urine turns orange yellow. Well, that is incorrect. This is an expected harmless side effect of the sulfasalazine, so it does not require discontinuation. Okay. So let's have letter D. Avoid activities that require alertness. That is also correct because the drug sulfasalazine can cause dizziness, and they should refrain from doing any activities that will require mental alertness, driving, up until they know really their the effects, or yes, their reaction to the medication. So make sure that they're refraining those kind of activities. If you answered letter E, skip a missed dose and continue with the next one, this is not going to be a good teaching here. Skipping a dose, skip a missed dose. That's kind of weird. Skip a missed dose and continue with the next one. They should not be allowed to skip a missed dose. Instead, they should take it as soon as they remember, unless the next dose is due soon. Let's have number 14. Which statement by a patient indicates they understand the nurse's teaching about sulfasalazine or the azulfidine for ulcerative colitis? Is it A, my dose will be reduced if I need surgery? B, I need to wear sunscreen when outside? Or C, I should avoid people who are sick? D, this medicine prevents infections that cause diarrhea. Again, we're talking about sulfasalazine. So what would be your teaching here? Or what would be that statement coming from the patient that indicates that they understand the proper use or what possible, what do you call this, action that they should do if in case they're going to develop something from the medication? The correct answer here is letter B. I need to wear sunscreen when outside. Your patient taking this medication will be photosensitive, so they should be using that sunscreen. If it's unavoidable, if they really need to be out in the sun, they need to use umbrella, use long-sleeved clothing in order for their protection, right? If you answered letter A, my dose will be reduced if I need surgery. Well, it doesn't require tapering before surgery. This is not like a corticosteroid that will require tapering, so eliminate that one. If you answered letter C, I should avoid people who are sick. This medication does not really suppress the immune system, so this is not really going to be a priority teaching, even though it's really important to avoid people who are sick, but it's not as a significant reasoning regarding this medication. Letter D, this med prevents infections that cause diarrhea. Nope, the sulfasalazine does not treat infections, but it can help manage the inflammation associated with ulcerative colitis. Okay, let's have number 15. The physician prescribes sulfasalazine for a client with ulcerative colitis. Which instruction should the nurse give the client about taking this medication? Is it A, avoid taking it with food? B, take the entire dose at bedtime? C, drink a full glass of water with each dose? Or D, stop taking it if urine turns orange, yellow? Now we already kind of know about the other options here. So what would be that instruction regarding sulfasalazine? The correct answer here, it is letter C. With each dose, right? Drink a full glass of water with each dose. This will prevent crystalluria and also prevents the, it's really going to prevent the stone formation for sure. Now, if you answered letter A, avoid taking it with food. Now, what you should instruct instead is to tell them to take it with food in order to prevent GI upset or distress. Okay, always do that. Maybe a small amount of a snack that can do. If you selected letter B, take the entire dose at bedtime. Entire dose, that is a red flag right there. What's supposed to happen here is that the dose is going to be taken, or doses should be taken throughout the day rather than taking it all at once. Okay. Letter D, stop taking it if urine turns orange yellow. This is again the harmless side effect of the medication, and it doesn't require discontinuation. And let's do number 16. A client with a history of Crohn's disease is admitted to the hospital with fever, diarrhea, cramping, abdominal pain, and weight loss. The nurse should monitor the client for A, high albumin levels, B, low platelet count, B, or C rather, low potassium levels, D, high calcium levels. Again, this is in the acute stage of Crohn's disease. You see there your lead: diarrhea, weight loss. Think about the fluid and electrolytes that are being lost in this scenario. The correct answer here would be letter C, low potassium levels. It is again a common finding in a patient with a flare-up of the Crohn's disease because of the excessive diarrhea. Again, potassium loss is of utmost concern. Okay, let's have number 17, which will be our last item of the day. During an exacerbation of Crohn's disease, which of the following should be the priority focus of care? Is it A, encouraging frequent walking, B, promoting bowel rest, C, maintaining the client's current weight, and D, reducing rectal bleeding? Exacerbation of Crohn's disease. Which of the following should be the priority focus of care? Carefully select the option. The correct answer this time is letter B, promoting bowel rest. If we are talking about a flare-up, bowel rest would be our goal. This is really going to relieve or reduce the inflammatory response. It can promote the healing. So we should be refraining, or we should teach the patient from refraining from doing a lot of physical activity this time. Fatigue. We should also provide them nutrition via non-oral routes around this time. Okay. Now, if you answered letter D, reducing rectal bleeding, it's not really a typical concern in Crohn's disease. The diarrhea that is characteristic in this disorder is usually non-bloody. Okay. If you answered letter C, maintaining the client's weight, we know that the maintenance of their weight is a secondary goal. And it is expected that this type of client will actually lose weight during the acute phase of Crohn's disease. So weight maintenance would be something that you should be concerned about after the flare-up has been controlled. Okay. Now that's it for today. I hope that you are learning from this Q&A. Please don't hesitate to ask any question. Post your questions in our as soon as this video is posted, please post your questions. If you have any clarification, please do that. And don't forget to hit the like and subscribe. And I will see you again in our next session. And we'll still focus on the gastrointestinal concepts for MedSurg. So I'll see you again. Until then, thank you and have a great day. Bye-bye.